President Biden says if updated vaccines or boosters are needed for Omicron, the U.S. will work with vaccine makers to accelerate development and deployment. Meanwhile, this new variant, of course, has everyone talking. So joining us now to go more in depth on Omicron is Dr. Rich Martinello, the medical director of infection prevention at Yale New Haven Health. Dr. Martinello, thank you so much for being with us.
Hi, how are you?
Very good, thank you. So I think there has obviously been a lot of talk about this new variant, and a lot of the concern comes from the fact that we are still learning about this strain. What do we know in terms of how different Omicron may be than previous variants like the Delta variant?
Well, we know that this variant contains quite a few mutations, and some of those mutations we have seen before in some of the other variants, and that's why there is such concern right now. And I think that concern is really well placed, but we need to know more about this. We need to know whether or not our vaccines continue to be effective, how easily this is spread between people, and whether or not the severity of disease is any different than what we've already experienced with COVID.
The timing of this variant coming into the United States, which seems to be inevitable at this point, isn't great in terms of we're talking holiday season, travel season, schools being in session with students back in the classroom. How do you think this variant could affect all of the above?
Well, I think just like you said, the timing could be better. And it is going to be a challenge for us heading into the winter season, especially as we see flu starting to circulate. But I think that the most important thing that we could do now is get our boosters if you haven't received it yet, and make sure that if you have not been vaccinated, now is the best time to start that vaccination series.
I know there is a push for people to go out and get their booster shot if they're eligible, also to get children 5 to 11 who may not have been vaccinated, get them out there and get their shots. But I think people are worried that these are fruitless efforts. And will we know, and when will we know, whether these current vaccines actually offer any protection against Omicron?
Well, we do expect the vaccines to provide an excellent level of protection, but it is going to take a few weeks before we have some preliminary data to help us better understand that. But we don't have weeks to wait. We do see this variant spreading pretty rapidly throughout other countries in the world, and now's the best time to get vaccinated if you haven't been.
We're also hearing some conflicting stories, I'd say, where some are saying Omicron is causing a mild illness, or others are saying that they are seeing some severe cases in hospitals in South Africa. What do we know right now, doctor?
Well, right now we just know those anecdotes. We're really still waiting to hear more firm data on what that spectrum of disease looks like. We don't have any solid evidence to suggest it's different than what we've already experienced with COVID.
All right, well, we know you're very busy and certainly appreciate you taking some time out of your day to share your expertise with us. Dr. Rich Martinello of Yale New Haven Health, thank you so much. We appreciate it.
Thank you very much.